Hello and good evening, everyone, and welcome to our Monday Night Live. We are going to have a really good discussion this evening, and I can't wait to get into it. Let us begin with a word of prayer. Heavenly Father, we give you thanks for this beautiful day, and we thank you, God, that you have provided answers. When the world may think that we just need to be on medication for the rest of our lives in reversing high cholesterol levels, you have already placed since the beginning of time exactly what we need to prevent as well as to reverse this condition in our bodies. And we pray that you bless our minds, that we understand everything that is being discussed. This is our prayer in Jesus' name. Amen. Okay, so welcome. Our topic of discussion, reverse high cholesterol in less than 30 days. This is so real, and it is not something that it's a magic pill or some expensive product that you need to obtain or go someplace in order to get it. It's right there within your reach that you can reverse high cholesterol. And it's cheap enough for everyone in the world to be able to acquire. So I am talking to you, welcome from Pure Wellness Lifestyle Center in Trinidad and Tobago. And we've been having quite a number of activities, and yesterday was no different. We had some individuals, some friends over yesterday, part of our medical missionary training that's ongoing now. And we got so acquainted with each other in the kitchen. And I want to give you a little sneak peek. I'll cut the movie short and it would be posted somewhere for you to look at the whole thing. Yeah, it's a movie. So let's get a little view. Oh, okay. This was our cooking class. So the students, they were preparing the meals for breakfast and for lunch. All right, praise the Lord. I think that's it. So that was really wonderful. Even learning about how to put a plate together and food combinations piece in a real way where it was hands-on and students, got that message really clear and also saw it displayed in the foods that they prepared. And it was one of the things that I observed is that they were all smiling faces. So, it just attested to the experience, a rich, rewarding experience that we had together. All right, so we want to look at reverse high cholesterol levels. And just to take a check in our chat box, or you could unmute your microphones. High cholesterol level. Do you know at least one person who has high cholesterol? Now, that might be well inside knowledge because people rarely would talk about they having high cholesterol. You might more hear them having hypertension or diabetes, but one person, do you know, who has had a heart attack, a stroke, and or high blood pressure? It's all in there as well, all connected to high cholesterol levels. Do you know? Let's see. Yes. Okay. You can just put a 1 for yes and a 2 for no. All right. If that's you, just put 1 for yes, 2 for no. Right. Mm-hmm. Good. And yeah. So it impacts us all in some way, whether we are near or far, whether it's us within our family, a neighbor, a friend. Good. All right. Well, see somebody put no. So we will see by the end of this evening whether, you would think again. And because I'm going to show you ways in which high cholesterol level can impact our health in many different ways. And so let's go. Here's a beautiful scripture, Proverbs chapter 4, verse 23. Above all else, guard your heart. Above all else, guard your heart, for it is the wellsprings of life. So we want to keep that heart, that little ticky-ticka going, and in a nice, healthy way. And so Exodus 15:26, and the Lord said, if thou wilt diligently hearken to the voice of the Lord thy God, and wilt do all that which is right in his sight, and wilt give ear to his commandments, and keep all his statutes, I will put none of these diseases upon thee which I've brought upon the Egyptians, for I am the Lord that healeth thee. The Lord gave his word to ancient Israel that if they would cleave strictly to him and to all his requirements, he would keep them from all the diseases, such as he had brought upon the Egyptians. But this promise was given on the condition of obedience. As individuals obeyed God, the blessings would come to them. A promise has been given that he will keep them from diseases. He will keep them from diseases. And the promise still extends to us even today. Proverbs chapter 26, verse 2, part B says, the curse causeless shall not come. So wherever there is a curse, let's look for that cause. And in the book Ministry of Healing, one of our textbooks, it tells us that disease never comes without a cause. And if you stop to think about cause and effect with our condition, so many times you're able to find the cause. And if you don't know, come share it with us and we'll help you find that cause. Because it is important for us to identify the true cause of our condition and be able to make a change to correct that. What is the definition of disease? Disease is an effort of nature to free the system from conditions that result from a violation of the laws of health. And so what are these laws of health? They're lovely principles, practices that every time I look at a condition, some health challenge, that I see the importance for these principles to be applied to the life. And when applied, correction of the condition will take place. The body will heal. Have you ever heard about the body can heal itself? Well, the creator of your body propels that healing. He aids that healing when we follow his manufacturer instructions for human living. And when we do, it's like putting the right fuel in your vehicle, then your vehicle will work optimally. And you would be able to go the distance. So when we do that to our human body, the manufacturer has a warranty on you and will help all of us to be able to achieve health and maintain that health. So let us take advantage of putting in the right practices within our lives so that we would be able to gain the benefits. It's no fun when we're sick and we long to be well. And I would always see that when you go to correct, you have to do the very same things that would have been required for prevention. But then it may be harder because it takes more effort because you will be weak and you may not be able to do everything that you need to, but at least God still blesses. And so let us think about preventative health in a real way, as well as looking for reversal and recovery. So what are these laws of health? These principles: pure air, pure fresh air to breathe in every day as opposed to polluted air. Getting sunlight on our body, for we know that plants will never be green if they did not get sunlight, and they would not thrive and grow, and flowers to blossom and bloom and bear fruit for us to be able to eat and be satisfied. Abstemiousness or temperance in all things, moderation in all things, that is good, and abstaining from that which is bad. We mentioned that last week. And then rest is important, getting that restorative sleep, exercise every day, proper diet, the use of water internally and externally, and trusting in divine power. These are the true remedies. And so the first thing to be done is to ascertain the true character of the sickness and then go to work intelligently to remove the cause. If the harmonious working of the system has become unbalanced by overwork, overeating, or other irregularities, do not endeavor to adjust the difficulties by adding a burden of poisonous medicines. Medicines, I would show you, have side effects. In the case of sickness, the cause should be ascertained. Unhealthful conditions should be corrected. Unhealthful conditions should be changed. Wrong habits corrected. Then nature is to be assisted in her effort to establish impurities and to re-establish right conditions in the system. The use of natural remedies require an amount of care and effort that many are not willing to give. Nature's process of healing and upbuilding is gradual, and to the impatient, it may seem slow. If we were to, just let nature take its course, we would think and find it is slow. You have a headache. How many times individuals would, wish that they have a quick fix, take a pill? But you can literally drink lots of water and help that headache to go away. The surrender of hurtful indulgences, which we may engage in, requires sacrifice sometimes to put those things away. But in the end, it would be found that nature untrammeled does her work wisely and well. Those who persevere in obedience to her laws will reap the reward in health of body and health of mind. So let's take a look at one of the cholesterol-lowering medication. There are many ways in handling cholesterol, and we're going to teach you and show you what you can do naturally to be able to not just manage your cholesterol levels or your blood pressure levels or other challenges that you may have as a result of having high cholesterol in your blood and in your arteries. We will show you how you can reverse it and get your arteries clear. All right, so it's talking about reversal and we're talking about prevention. But one of the ways in which individuals may be informed for managing or reducing high cholesterol levels will be to use drug medication, cholesterol-lowering medication. One of them is Lipitor. So Lipitor would do what it says it's supposed to do to lower the LDL. Another name for Lipitor is atorvastatin. And so you may just have this knowledge about this, but Lipitor was a name and may still be in some societies, but atorvastatin is the same thing. And so it's a statin drug to lower this cholesterol level, and it's going to lower the LDL and triglycerides, the fat content in your blood. And that is what we want. But here, if you look at the side effects, common side effects, indigestion, incomplete and infrequent bowel movements. That sounds like a little bit of constipation. Gas. How many folks have gas? And bloating, stomach cramps. And then you have some infrequent side effects, but still affecting individuals, joint pains and reaction due to an allergy, allergic reactions, throat irritation, sinus and congestion, flu-like symptoms, pain, rash, head pain, diarrhea, numbness and tingling or pain in the hands and in the feet, muscle problems, increased pressure in the eyes. So it's going to give you some vision problems. Pancreatitis, inflammation of the pancreas. That is not good. Eye hemorrhage, angina, blood pressure dropping when you stand, and so you may feel dizzy. Hemorrhage of blood under the skin. So you get these patches of purple looking, or a dark red, where you're getting these blood blotches under your skin. And let's look through. You have hepatitis, liver failure. Your liver enzymes can be elevated after you continue to use this statin drug. And then your liver begins to malfunction. And you can have other issues. Your feet can begin to be swollen. You find that your digestion is poor because your liver isn't helping out there with production of bile, whatever, so many other functions of the liver can impact us, even having kidney stones. What about inflammation of the bladder? And you may be urinating frequently as a result. And the list goes on. Enlarged breasts and stiff neck, Stevens-Johnson syndrome, rupture of a tendon, you find muscle pain. Lots of the statin drugs are connected with affecting your muscles and muscle pain. I know some time ago, a lady shared with me, I used to be able to lift my market bags, but I found that I could not do that anymore. And I was talking to her now about making changes. so that she would be able to come away from her medication. But just to have that muscular strength, she did not have that anymore. Leg cramps, fluid retention in the legs and feet, arms and hands, trouble breathing, chest pain, abnormal liver function test here, elevated protein in the urine. And you do a urine test, protein is high, why? Check your medication side effects. Low sugar, low blood sugar, gout, anemia, lazy eye, dry eyes. Yeah, this is quite common. So you're on the statin drug and your eyes are dry all the time. You know, so listen to this. You have one condition, high cholesterol levels in your blood, and you go to medication to bring that down, and you are at risk of getting so many other conditions. Dry mouth, a painful red and swollen mouth, sun-sensitive skin, itching, hair loss, arthritis, that's a whole other condition, and loss of memory. This list doesn't seem to stop. I one time counted it. It's 82 of them that's listed here, 82 side effects. And the mere fact that they're listed is that it has affected individuals enough so that it makes it on the list. You know, fever, chronic trouble sleeping. This is big. A lot of folks are having difficulty to sleep, excessive sweating, and loss of appetite, heart throbbing, swollen lymph nodes, throwing up, and high blood sugar. So your blood sugar could be on the swing. Sometimes it's low or high. High blood sugar is another way of saying diabetes. So you see, you can be on the drug medication and get high blood pressure, get high blood sugar. Here's another one, simvastatin. And again, the list is not short. It's used to lower LDL cholesterol and triglycerides and to increase the HDL as would be required. However, it can give you, put you at risk for several side effects. Diarrhea, dizzy, feeling like throwing up, gas, head pain, heartburn, very much like the Lipitor. Stomach cramps, arterial fibrillation. So your heart rhythm is irregular. Muscle pain here, again, it's a severe side effect. And this is your muscular pain. You know, in your legs, you can become weak, or you can just be so painful in your muscles in your legs that it makes it difficult for you to walk. And you're wondering what is going on with you, and you're taking pain medication for it, not recognizing it's your little tiny tablet. So that's doing all this drama on you. Eczema, a burning stomach, low energy, sinus irritation. So very much, you know, all the statin drugs having similar side effects. What about cataract, bronchitis, arthritis? These are conditions that can result from drug-induced diseases, okay? So you can have drug-induced diseases and chest pain, hepatitis here again, liver failure there again, lupus, and muscle inflammation. So always consider your history and your exposures, and if what you are suffering with today is as a result of your medication, UTI, anxiety, blurred vision, right? Confused coughing, dried skin, enlarged breasts, so high blood sugar, lots of all the statin drugs have the same problem. So skin nodules, all these little growths on the skin, look at your medication. And the point is, we're not saying to you to come off your medication, but just be aware of these side effects and always check to see if what is happening to you is as a result of the med. And that to me should motivate you enough to make changes with your diet and with your lifestyle so that you do not need to be on that medication anymore. And so too little attention is generally given to the preservation of health. It is far better to prevent disease than to know how to treat it when contracted. By the use of poisonous drugs, many bring upon themselves lifelong illness, and many lives are lost that might be saved by the use of natural methods of healing. So I want to take you to matters of the heart. Here are a few fun facts about our heart. It is a bit larger than the size of your clenched fist. In men, it's just about 10 ounces in weight. And then for women, it's about 8.5 ounces. So it's a nice little heart in your body. And so a normal heart can beat anywhere from 60 to 80 beats per minute. And the blood can cycle through the body 60,000 miles of blood vessels each minute or more if you're overweight. So 60,000 miles of, if you were to count all the circulatory system that your blood goes through, and if you have some extra weight, it has more area to cover. Now, each beat of your heart and each beat of each ventricle pumps about 4 ounces or 2,100 gallons each day. That seems a lot, but that's why we need to have adequate blood volumes because there is a need for blood. It's the life, it's a fluid of life. And both the rate of beating and the amount of blood that's ejected with each heartbeat may double when you're doing vigorous physical activity. So just to walk up a hill, your heart has to beat harder, and so it is even doubling up more than what it would if you were at rest. If you were lifting up heavy things, your heart rate will increase. If you are walking busy, running, hustling, your heart rate will increase. And that's why sometimes individuals have heart problems. And I would say to them, walk, please walk. Do not do aerobics where you have to kick and punch and all kinds of things within a fast time because you're looking at the instructor. By the end of that, you're going to feel weary, you're going to feel faint, and you may be out of breath. Your heart, if you have a heart condition, your heart cannot take it. All right, your heart cannot take it. It might be some area that's not functioning well, where the blood flow has some obstruction, whatever the situation might be. So always, if you have some heart condition, walking is the best form of exercise for you. Nothing too strenuous. And even when you're walking, if you have a heart issue, don't be too fast in your walking either, because that can put more pressure on your heart, cause your heart rate to be increased. So work with your body in an understandable way so that you don't hurt yourself. The heart pumps 24 hours a day, or every day, every week, every month, all through our lives, maybe for 70, 80, 90 years, the heart is pumping all the time. However, in between each beat, there's a rest. And thankfully, God gave that rest, which is about almost 16 hours in a day. Imagine your heart not beating for 16 hours. That seems like, wow, but it's a beat and pick up. It's a rest and pick up, rest and come again, rest and come again. So with that, you don't feel like it's not beating. But, so we are marvelously made. Just by way of looking out, I'm talking to you from Trinidad and Tobago. And what do you think is the #1 cause of death in our society? If you are here on the line, tell me which country you're from, and let's see where we have the most visitors from. But this is other than Trinidad. Okay, so if you're other than Trinidad and Tobago, just tell me which country you're from. And so coronary heart disease is number 1, top on the list, followed by diabetes mellitus. Stroke, number 3, prostate cancer, number 4, number 5, violence, and the list goes on, looking at the top 50 causes of death in our nation. So, are we on target with addressing a topic that is relevant? All right. USA. Welcome. Welcome, Sister James. All right. So maybe we can just have a look. And that is a website that you can go to, worldlifeexpectancy.org. And if I just show you what this looks like, this is the website. And as we go, United States, and nice picture of the canyons. Number 1, we're just the same. Coronary heart disease. Now, look at that. And many places throughout the world, it is similar. Coronary heart disease, either number 1 or in the top 5 causes of death. And this is ranking at 142 in the World Bank rank. And Trinidad, I believe, is 137. So let's see. All right, so we had USC twice. Hello, Sister Louisa. And Louisa, right. So coronary, just to tell you, it's on top of there. And let's go back to our slide. Okay, so what is coronary heart disease? It is a type of heart disease that occurs when the arteries of the heart cannot deliver enough oxygen-rich blood to the heart muscle due to narrowing from the buildup of fatty deposits called plaque. All right. And so the buildup of these fatty deposits called plaque, it also sometimes called coronary artery disease or ischemic heart disease. So when you hear coronary crown, like a corona crowning, that's how the arteries surround the heart. And then that heart, it is going to pump blood, and in that blood will have oxygen and nutrients to take to different parts of the body. However, there can be a problem when you have some fatty deposits inside of those arteries. Yeah, and so the pipeline needs to be cleaned. And if it isn't, problems. So cardiovascular, coronary heart, these terms are sometimes used interchangeably. And then you have angina, which we'll talk about one day, then heart attack. But addressing the root cause, which is what we're going to be looking at now, will help take care of all of these. Hypertension, stroke, and the list goes on. Now, the risk in heart diseases can be increased. And if you look at the red, it's a high risk all connected to diet. For obesity, diabetes, cholesterol, high blood pressure, and high triglyceride levels, diet plays a huge role in there. When it comes to lifestyle, smoking habits, stress, and when it comes to uncontrollable factors, you cannot control your gender, your genes, your age. That may put you at risk for heart disease, but at the top of it is diet, having such a greater impact. And we will cover diet, but cholesterol is high on the list. How can you reverse your high cholesterol level? The other day I had someone with a high cholesterol level in January month, not with us at the time, but by the time the person came with us and was leaving, had a cholesterol level of 201. And that was really good because you're coming down nicely. And my belief is that in those latter 18 days spent with us, or by 17 then, or even less, than 17 by the time we did the blood work. Could have been about 15 days that the cholesterol dropped even lower, because I've seen where we had someone here at the center one time, the stay was short, but we still did some blood work at the start, and the cholesterol level dropped by 9 points in less than 7 days when we did another test. So by changing the diet, you saw that chart I just showed you here. Changing the diet can impact your cholesterol levels. Changing your diet can impact your high glucose level, your diabetes, your obesity. Changing your diet, you could reduce the weight. Changing your diet, you can reduce your high blood pressure and your high triglyceride levels, that fat deposits within. So diet, exercise, rest, trust in God, just no stress. All of those things can help to reduce cholesterol. So what exactly is cholesterol? Cholesterol is a fat-like, wax-like substance found in the blood. Fat-like, wax-like substance found in the blood. Here's a picture of what a 37-year-old person look. Their blood work, the blood was drawn, and when it settled in a vial, all this fat-like, wax-like substance found in the blood. And that's what it looked like. Could it be for you just the same? And look at this picture, atherosclerosis. I just want to show you how a little medical explanation about this. So let's just go to our link and be able to. Yeah.
Atherosclerosis is a disease of the arteries, and therefore it can affect any artery in your body. The most likely arteries affected are the arteries to your heart, the arteries going to your brain, or the carotid arteries, and the arteries in your abdominal aorta going to your legs. Atherosclerosis is essentially a degenerative condition, and it involves the development of plaque in the wall of the vessel. But as it develops and progresses, it encroaches on the artery and therefore can cause narrowing of the artery and therefore limit blood flow. There are a lot of causes of atherosclerosis. There's not one thing that causes it. So it really is a disease or a condition that has many factors. And we call those risk factors. And they include diabetes, hypertension, high cholesterol, smoking, and family history. Most patients that have atherosclerosis will describe a family history, but it's not a very strong predictor, and it doesn't doom you to having coronary disease or atherosclerosis. It's important to note that you can have a lot of atherosclerosis throughout with no symptoms. And so the lack of symptoms doesn't mean you don't have this condition. It's really only until arteries get narrowed severely that it leads to some of the symptoms that you can develop. So starting with the heart, patients can develop chest pain, they can develop shortness of breath, and symptoms related to the blocked arteries. If you have atherosclerosis in your leg arteries, then you may develop pain or discomfort in your calves, in your thighs, or in your hips when walking. And then finally, it can affect the arteries going to the brain. And so those would cause symptoms that are worrisome for stroke. And that would include things like slurred speech, transient weakness or numbness, difficulty with their vision. Medications are really the first line treatment. And those medications are designed to help reduce cholesterol and to stabilize the disease process. Then there are more aggressive treatments that are used. We call them revascularization, and those are to restore the blood flow. And there's a lot of different surgical options. Those surgical procedures are more aggressive, there's more risk involved, and they are reserved for patients who essentially fail medical therapy or have very severe advanced disease that requires restoration of blood flow. So the advantage of UVA is
Okay. We'll stop that right there. Okay, so I hope that just gave you an overview and of atherosclerosis as we continue to discuss here. And so all this fatty deposit that is growing inside the walls, in a lining of your arteries, you know, that tends to grow over time, narrowing the passage for your blood to flow. And if the growth is on both sides, look at what is happening. Maybe at some point they can meet each other. So your arteries, remember, it carries blood to different tissues and organs. It carries oxygen. It carries, putting out your nutrients in there too to get into your capillaries and so forth. But fatty streaks may appear in this inner lining, and that can grow. And it can even start off from childhood. And right now in our society, in our world today, you're seeing that this disease shows up in not just the aged, but individuals who are younger in their years, who are less than 50, sometimes in their 30s, in their 20s, 30s, in their 40s. I see it in their 20s, even there in their 20s. You do have it. I watch the diet. I know what's going on in the body. It's plain and simple. You know, the high-fat diet, the fast foods, and so on, all those things feed this problem. So your artery should be nice and clear like this. But what happens? You begin to have a fatty streak. What is that? It's a plaque buildup. That same growth in the inner lining of this artery that's gonna grow. Don't you see it's growing here? It's growing, and soon it's gonna grow so much that it's narrowing the passageway. Your blood flowing, yes, but limited and not getting to certain parts of the body, which is hugely important because then your organs will not get adequate supply of blood and they can begin to reduce their function. And furthermore, it can even fail on you. Interestingly, many times you may have wondered, well, what is in this fatty deposit? Well, it consists of your muscle cells. So the smooth muscle cells are there, yes. And if you notice how they have these little ridges in between them, from your diet, from stress, from things that will cause the fat in your blood to be produced. And stress can do that too, cause your liver to produce cholesterol. And that gets into, it's a fat deposit now in your blood, can get in under these, intertwining of the cells, get inside and begin to grow and grow and grow in your arteries. So you have, it consists of muscle cells, cholesterol, calcium salts, fibrous tissue, and collagen. That seems pretty strong stuff to me. So you can just imagine how tough this plaque is. You know, when you go to the dentist and they talk about plaque on your teeth, and they go scraping, and you want to know what they're scraping, and you didn't see that with your eye, but it's there. And so imagine all of this there, it's just concreting on the inside of your arteries. It's known as atheroma or plaque. Look at it here. See the inner lining and underneath the smooth muscle cells right there, you have that going on. So here's another clip. Did you know that Bill Clinton had some heart issues? And until he decided to make a change, I'm not sure what his status is right now, but this was back in the day.
How did you lose so much weight? What kind of diet did you?
The short answer is
I went on essentially a plant-based diet. I live on beans, legumes, vegetables, fruit. I drink a protein supplement every morning. No dairy. I drink almond milk mixed in with fruit and a protein powder. So I get the protein for the day when I start the day out. And it changed my whole metabolism, and I lost 24 pounds. And I got back to basically what I weighed in high school. But I did it for a different reason. But I mean, I wanted to lose a little weight, but I didn't dream this would happen. I did it because after I had this stent put in, I realized that even though it happens quite often that after you have bypasses, you lose the veins because they're thinner and weaker than arteries. The truth is that it clogged up, which means that the cholesterol was still causing buildup in my vein that was part of my bypass. And thank God I could take the stents. I don't want it to happen again. So I did all this research, and I saw that 82% of the people since 1986 who have gone on a plant-based, no dairy, no meat of any kind, no chicken, turkey. I eat very little fish. Once in a while, I'll have a little fish, not often. If you can do it, 82% of the people who've done that have begun to heal themselves. Their arterial blockage cleans up. The calcium deposit around their heart breaks up. This movement has been led by a doctor named Caldwell Esselstyn at the Cleveland Clinic, Dean Ornish, whom you know, out in California, the doctors Campbell, father and son, who wrote the China study, and a handful of others. But we now have 25 years of evidence. And so I thought, well, since I need to lose a little weight for Chelsea's wedding, I'll become part of this experiment. I'll see if I can be one of those that can have a self-clearing mechanism. We'll see.
I hope you're healthy for many years and get to see grandchildren.
Okay. All right. And this was his experience. You know, he lost 24 pounds and going on, he had a little fish, but if you went total plant-based, he could have lost even more if he had it to lose, you know. But there are individuals who, by following a total plant-based diet and following the way that God has created us to go, that they were able to lose more than 24 pounds within a short time. And his story is like so real. I have a colleague out in Tennessee, and at one time, Bill Clinton was at a hospital and close to the area where she was at, and she has a private practice with integrative medicine, as well as a restaurant, a health food restaurant. And the hospital called her and asked for them to provide the meals for Bill Clinton while he was there at the hospital for his medical checkups and so forth. So she told the staff, okay, I'm gonna go. And she took all the food, got everything ready, and then went personally to meet him and deliver healthy food, plant-based food and desserts to go with it and everything. So, you know, it's real for what he shared here. And then we were able to get further details about other experiences. Now, symptoms of high blood pressure, cholesterol, and this is interesting. Symptoms of high blood cholesterol. So high blood pressure, yes, as you saw, the arteries being narrowed. Imagine now your blood pumping out of the heart meets this obstacle, meets this narrow passageway. Anytime there is work construction going on your highway, wouldn't there be backup? Wouldn't there be traffic and everything will have to go slow? 3 lanes down to 2 lanes, or 2 lanes down to 1 lane, and you're going to have a backup of traffic. Similarly, in our bloodstream, in our arteries, you had all this span, and then now it has to be narrowed to pass through an area that's impacted by this cholesterol plaque deposits. And so you're going to get a backup of that blood. The blood part has to work harder, pump, beat harder. Your pressure will go up. So part of reversing your high blood pressure, know that you have to reverse cholesterol too. and break up those plaque deposits and clear the way, clear the artery. And it is possible. It can happen. And it can happen naturally. You can do it. And then the blood is going to flow through. Pressure will be normalized and you're going to be happy. The organ's going to get the blood that they need and it's going to function better for you. Now, change in vision, chest pain, xanthelisma, poor circulation, slow wound healing, neuropathy. And I'm going to look at this right now. Atherosclerosis, which is hardening. So atherosclerosis, thickening of the arteries through the calcium and cholesterol calcium plaque deposits. And then you have atherosclerosis, which is the hardening of the arteries. Then you have low extremity pain in the hands and feet. I'm going to show you this: erectile dysfunction, diabetes. Diabetes, as insulin production is reduced because you find that cholesterol can cause a buildup of in the beta cells. So your beta cells having too much cholesterol in the cells, and that can impact your insulin production. So your beta cells are found in your pancreas. Your pancreas produces insulin. If that is impeded, not working well, you find your blood sugar can be elevated. So what is another sign or symptom of atherosclerosis? This buildup of plaque deposits in your arteries. It's called xanthelisma. So xanthelisma or xanthelisma tap, the plural form, are deposits of cholesterol under the skin, right under the eye. Look at it here. See that? See that all around? I have seen this for real in several persons when they consume items that can elevate their cholesterol levels in their blood. And we'll show you what that looks like. I'll tell you, one was coconut milk. Yes, coconut milk. Coconut milk, and you use that in good volumes, high volumes, day after day after day in your dishes, can cause this issue because it has saturated fats in it. So we want, but the animal products will do that as well. And we'll explore some of those in another session. But this is one evidence of high cholesterol in the bloodstream. Another sign of atherosclerosis, that thickening plaque deposits in the arteries. Look at this, a diagonal earlobe crease. Yeah, it's called Frank's sign. What does that look like? It's a little wrinkle about 45 inches beneath the, right there, watch. See this? Yeah, look at it here again. So it's called Frank's sign or that earlobe crease. And that can be an indicator. I say can because sometimes folks may have corrected their situation, but it can be an indicator of the buildup of plaque in the arteries. All right, there's scientific paper to show that. Now you also have another one, and this is the frontotemporal crown top baldness. Big kind of fancy word. Alopecia, where the hair can fall off. So you get some balding of the scalp. You have hair loss that progresses up until a rim is formed around the head, you know, where some individuals have hair all on the side, but none at the top. And so it looks like this. Hair all on the side, around to the back, but none at the top. At the crown, you have crown baldness. So this can happen for men as well as for women. Here's another one where you have high blood pressure and cholesterol levels, where you see the leg here being swollen. And that can be as a result of, look, a narrowed passageway. And if at some point, this very well can be a risk for getting blood clots. Peripheral artery disease. What is that? when you have poor blood flow in your lower extremities. Don't you see this happening with individuals, maybe someone you know, and poor blood flow? Why? Because the plaque deposit is right here in the calf area. Look, plaque deposit growing and reduces the blood flow to the lower part of the leg. Sometimes it takes place higher up in the artery, higher up the leg. And so all along you have pain. Individuals might be limping with pain when they attempt to walk and not knowing that the blood is not going down as it should, or the blood forcing to go down in the blood vessels, in the artery to the blood vessels, and you find that you have pain. But you also have more. You got spider veins, you got varicose veins, you have edema, which is a swelling in the lower limb, eczema, all this skin rash situation, pigmentation, darkening. So there are times when individuals come here to the center and they would tell me their toes or their foot or their leg is, and you would see it all dark, and they would recognize it more because they have been accustomed seeing it one shade. And simply by having the dietary change, more exercise, walking, and some detoxification therapies, and increasing blood flow through water therapies and so forth, you find that all that darkening clears away and they are beginning to see their true complexion. Look at all the scaling on the lower limb and even wounds and so forth that may seem troublesome, ulcers, foot ulcers that can appear troublesome to heal. When the diet change happens, when you go on a total plant-based diet, it makes a huge difference where all of these things cleared. You get an artery clear again, the blood can flow through, and the healing will come. This is a nice one, and we will just have two more. So here, erectile dysfunction. That is another symptom. Many times when the men go and they complain about erectile dysfunction, a good doctor will also advise that you have some blood work and check to the heart. Let's just check the heart and heart rate, do some ECG, whatever might be needed if you haven't done that in a while. So you want to look at erectile dysfunction. Why? Because the artery that meets and connects to that penis here, you find if it has that buildup of the cholesterol plaque deposits in it, then that organ will not get adequate blood flow. It needs adequate blood flow in order to rise up high, and having the arteries cleared, taking care of your heart, taking care of those cholesterol deposits, reducing them will correct this. Now, there are other causes for erectile dysfunction, but this is one of them that's pretty huge and top and high on the list. What about vision loss? Could it be that you are experiencing some poor vision due to buildup of plaque deposits that connects to your eyes, your retinal artery? And then you find that you may have some vision issues, like here, where you have a symptom of retinal vein occlusion, where, look, you could barely see. Central retinal vein occlusion will show like this, where the center point of your vision is impaired, or if it's a branch part of the eye where you have the occlusion taking place, that little blockage taking place, you find that this portion, some portion on the extreme end may be impaired. You don't have the vision there. And it's because of the plaque deposit that is not allowing the blood to flow through, or sometimes that plaque can break, or you get fragments of it that moves around in the vessels towards the eye and can cause all of this. So when you go to the ophthalmologist, they would take some pictures, look behind the eyes, do some screening and look behind the eyes to be able to get some more information as to what is happening there. So basically, we will pause there for now, but I will let you know, do not miss our next session because I have some more information about how we could correct this. And I have a very interesting little video clip that would show you what the inside of those arteries look in the operating room, and you will be amazed. You will be like, wow, if that is in me, I certainly want to be able to take it out. So I just want to share with you a nice healthy recipe that is cholesterol free and can be quite tasty. So tofu oat burgers, 2 cups of quick oats, 1 pound of soft tofu, 1 cup of finely chopped onion, 1 cup of walnuts or pecans that you grind it up, 1 teaspoon of Italian seasoning, 1 teaspoon of paprika, 1 teaspoon of your pink Himalayan sea salt, or Celtic sea salt if you have that. And then you blend all these ingredients well and you squeeze it and to form it into burger shapes. You can cover and just brown it on your stovetop in a skillet, or you can put it to bake. I would like to bake it, and then you would just check, make sure it's nice, properly done, top and bottom. You can turn it over. So try this. Once you have the oats tend to bring things together. I'll say toast your oats first so that it's healthier, and that would be like you bake your oats for about 3 hours under in the oven. That is just to get rid of certain things like phytic acids and other things that are in the oats. But you want your oats, your quick oats, your tofu, your onion, season it up nice with your Italian seasoning, paprika, salt, and you have the little walnuts there as well for a little crunch. So if you don't ground it, you can just break it up and you get a nice crunch. And do go try this and enjoy your tofu oat burgers. So we want to have a word of prayer as we close out right now. Heavenly Father, we want to give you thanks for the blessing of this evening and for our discussion. We ask for your continued grace to be with us. And even as we seek to go into our Q&A, we pray for your continued blessing. This is our prayer in Jesus' name, amen. All right, so the floor is now open for you to ask questions. Make how many? Okay, for the tofu burger, I haven't, it can make about 16, depending on the size of your oat burger. Yeah, so depending on the size. Right, so any questions? Yes.
I'd like to share if you let me, please.
Yeah, sure.
So I would just like to let everybody know that this information that Dr. Nash is sharing about the laws of health, that I live by that. And people don't believe I'm the age I am. Doctors are asking me, doctors, nurses, anesthetists, they're asking me, what do I do everywhere I go? And every time I go, I have to explain to them, well, what do I do? Because they said they have never seen anyone as healthy as me. And especially at my age, because I'm 28 and I'm almost 28. And they're looking for me to bring my purse full of medication. And I tell them I do not even take an aspirin. So I get a clean bill of health when I take I have no cholesterol, no high blood pressure, none of that. And I'm losing weight. And I love my food. And Dr. Nash, I'm going to try that that tofu burger tomorrow. Yes. Yes. So I don't eat any meat at all, none whatsoever. And all my meals are so delicious. I love my meal. I chew it from one side to the next side and I enjoy it. And so I live by the 8 laws of health. and I'm totally plant-based, and I thank God that I'm healthy. So I to everybody, you can put a lot of meals together, and you have to put it in the combination that you'll get the benefit from it. And I do all of that. And so I love my diet. I exercise, I lift weights, and I'm almost 28.
So you're giving the people some homework and a little mathematical riddle there. Sister Raman is almost 28, 28, okay, but she's lived for 8 decades plus. So just do the little math or symmetry to flip it around. Thank you so much, Sister Raman, for sharing with us a real, true life testimony about the benefits of healthful living and eating. And I mean, it's so rewarding and just to have a clean bill of health. And tell you, it's even more rewarding that if you had a condition and you made the required changes and you got your condition reversed and cleared, you're going to be so happy, really, really happy, thanking God for a new lease in life and being able to feel healthier and for it, more energetic, purposeful, just looking forward to the future with vitality. Yep. And I just have a testimony, I accompanied one of my neighbors today who I've been helping, and I would share her nice story at some point. But she actually had an amputation done in December. We have full healing and everything. The wound, it's beautifully healed. And she got discharged from the hospital today. So I wanted to really jump up physically in the place, but I sort of kept my feet on the floor, but I was just like praising God, thanking him for his blessing. And yes, by making the dietary changes actually helped to lower her glucose level. She told me this morning upon waking, it was at 99, where it was super high enough to cause an amputated leg. So it's really beautiful. All right, so Sister Jane's gonna try the recipe too. Thanks. Any questions about some of the connected results of looking at areas in the body? Any organ that doesn't get adequate blood supply, you find that there's going to be an impact on the health and function of that organ, right?
Dr. Nash, when you talk about the alopecia around the crown of your head, is that reversible?
Yes, it is. One of the things is to increase blood flow to the head. And what they were looking at there in that condition as well, again, you go back to the diet. So we correct the diet, get that plaque deposits broken up, cleared away from the arteries so that you can have better blood flow to the head. Of course, it can be a challenge for some individuals. It is a process. But as you make the changes and you do your exercise, you get a rest, you make lots of those changes that's required for improved health and its outcome, then the blessings will come by God's grace. Yeah.
Thank you.
Good night. What accounts for a person not sleeping? Like you may go to bed early enough, 8 after 8 minutes to 9, and then sometimes like all minutes to 1, 2 o'clock, you're up for whatever reason. But I mean, when I say whatever reason, you might use that time for prayer. But why you're not sleeping? What causes you not to sleep? Or like 2 o'clock, 3 o'clock, 4 o'clock, then you might drop back to sleep.
Yeah.
And yeah.
All right. So question. Well, we have a list of things like for sleep hygiene. But when is your last meal in the evening?
After 5 minutes to 6.
Good, nice, that's good. And do you exercise during the day? Walk?
Sometimes, well, I walk. Well, I try walking
Mhm.
and riding the bike.
All right.
But it doesn't mean like a everyday something. I try. My promise myself was to try and do at least 15 minutes in the morning, 15 minutes in the evening. I started sometimes, but I must admit I'm not consistent.
Okay, so we want sleep every night. So we need to do some of the supported things every day. So getting your walk at least 30 minutes can help you. If you got more time in there, but every day, make it happen. It's important because as the body gets, worked out and with activity, that can tire you. And so you can have better sleep in the nighttime. All right. So what about sunlight? How much sunlight do you get?
No, that sun is so very hot. I mean,
Okay, the nice sun. Like on about 10 o'clock, where the
no,
breeze
10
is
o'clock in the day.
blowing. Yeah,
You go outside to
evening.
hang out close in 10 o'clock in the day, you feeling like that sun burning through your skin. No, if I have to get sun, it have to be like I do early in the morning or when the sun going down all day, 5 o'clock, stuff like that. But I am a
That's
very
not a
active
healing
person.
time.
I go through my whole day. I don't sleep any day, so I just keep going. So you find that's why as soon as it started dark, everybody who know me, they say I'm a fool because I get in my bed early.
Mhm.
As I say, I may sleep sometimes and then sometimes it's like, but I noticed that these days, because I was sleeping good all the time, I noticed like
So what
minutes
time
to
you go to sleep?
one. Huh?
What time you put yourself to sleep?
You see, like now I come in bed after 8. So I know
Mhm.
just now minutes to that I'll be dropping off by 9 o'clock.
That's
I
still
should.
good. So, but the thing is, you're running away from the sun, and that can very well be your answer there. I want you to try that within the coming days and come back next week and tell us what it has done for you. It's because you need to get the healing power of the sunlight. And early morning, late evening, it's not really that. So more within the core of the day. For us here, anywhere between 9 a.m. and 3 p.m. If you go 9:30, 10, you spend a half an hour in the sun, at least half an hour every day. It can make a difference for you. You want to reset your circadian rhythm. You want to increase serotonin levels within the bloodstream that can turn into melatonin at night and help you to get that restful sleep for longer. So sunlight is therapeutic. And in the core of the day is where we can get greater benefits, even to fight infection, to prevent diseases, autoimmune conditions, so many issues, including sleep. So you are fortunate to be in a country where you have sunlight available, as opposed to others not having it available to them all year round. So try as an experiment and knowing that what you're doing is helpful to get that sunlight. Put yourself out into the sun. That same clothes, you go to hang out. Don't run in and out, out and in. Take your time and be out there. Walk around, do some activities outdoors, and that can help. And you see, a lot of things, even looking at your gut health, and how is your digestion? How is your digestion?
My digestion is good. I don't have
Okay.
problem. Mm-mm.
All right.
I
So,
try to watch what I eat and
very
stuff like that. You
yeah,
know.
have lots of lettuce in your food, so you get fiber, your vegetables so you get more fiber to help feed your beneficial gut bacteria. So let's work with getting you some sunlight and to balance that hormone to be able to get restful sleep at night. Drink your water earlier. And even in that evening meal, is it something light at 5 o'clock?
It may be a sandwich or sometimes cornflakes and milk. I try to not to do too much everything.
Right.
We have
Yeah, but you want food to be like
tea,
just.
I may have ginger or tea bag or
Mhm.
that next where is it? One of those bush there on the outside there I use. Yeah.
Okay. All right. So do many things. Do the lavender oil, essential oil, do chamomile tea instead. So have something that's quite calming and relaxing. Have a routine, a warm bath, dark room. Keep all lights out of your room, put yourself to bed, and that should help make a difference for you. Don't worry about anything. Don't look at the clock when you wake. All of those things.
And
Okay.
Dr. Nash,
Yeah.
I used to feel like the sun was too hot as well. But what I did was I dressed the way you all taught us to dress, with the long sleeve and the broad rim hat and the shades and all that. And I just walk around the back of my yard, back and forth. And I got my sunlight like that. And plus I got some exercise in at the same time. And that helped me. Yeah, that helped me a lot. And then also I had a problem sleeping as well, like she's saying. But once I started to live, to change my lifestyle to accommodate the 8 laws of health, and I started to take the ashwagandha root. I began and going to bed the same time every night, just laying down, and whether I felt sleepy or not, I just closed my eyes in the dark room, and eventually I just started to sleep every night the same time. Even if I don't lay down, I feel sleepy, so I have to lay down and go to sleep at the same time. It just
Right.
automatically happened.
Thank you. Okay, I see a question in the chat. What can you use on your face to get rid of discoloration on your face? All right, so we need to find out what is causing the discoloration on the face. And is it an allergy to something? Sometimes it might be an allergy to sugar. It might be an allergy to wheat. That can cause, an increase in glucose levels. And so by removing those items can help make a difference. So have a think if it is that you're putting items on your face and then going into the sunlight, there might be some interaction there. But checking from an allergenic perspective and see what, make some changes and see what it can be possible. Another question, my bad cholesterol is 115, but my good cholesterol is 78. Does that count for anything? Good question. We will come to look at HDL and LDL values in another presentation coming up. However, apparently the LDL is 115. You want that to be closer to 100 and below. So closer to 100 and the HDL being 78. If you're a woman, you want it closer to be around 50. If it's a male, around 75, thereabout will be good for you. Cold extremities at nighttime with pain. What is the cause? It sounds like poor blood circulation. So as you lay, you find that you're not moving as well during the nighttime while you're sleeping, and that can cause the poor blood circulation, which will result in pain. And if the limbs are cold, you want to increase your movement, your activity during the day. You also want to be looking at your clothing, that you have long So the longer your clothing is on your limb, your hands can be warm. If your sleeve was short, it has all of this length exposed, and then your hands can be cold. Similarly, for your feet, if you had longer clothing that's closer to your feet can be warm because the blood is going to draw all the way lower in you. Then looking at your gut health again. So that's another aspect we want to explore. If you need plant enzymes, if you need probiotics to help for a healthy gut, can also influence your metabolism and whether you have cold hands or feet at the same time. So, and even at night. So watch the clothing, put a socks on your feet so it helps to pull blood all the way down on your feet. And inflammation can also be an issue there. Sometimes folks with arthritis may wake up with stiff joints and due to inflammation. Just wondering, would you get skin cancer if you walk when the sun is really hot? Well, it depends on we're not saying to be there forever. There is a time frame. So for darker complected individuals, it could be anywhere from 45 minutes to an hour and a half. If you do 30 minutes, if you can do 45 minutes to an hour and a half, the more dark you are, that's sunscreen, that's melanin protection, and you will not get skin cancer once it's done in moderation. So if you're out in the sun for extended periods of time, again, your clothing is important. If you recall, individuals who work on the roadways, on the streetways, they usually have long clothing. So some cotton uniform or something, and their skin is protected. People who are on the highways doing work, their skin is protected while they're out there in the sun for that lengthy period of time. Being here in the Caribbean and other tropical countries, skin cancer is rare. And then again, having a total plant diet, fruits and vegetables can avoid skin cancer. Being hydrated can avoid that. And when you are in northern countries and you have a complexion of a more Caucasian type, you may be at more risk of getting skin cancers. And I've seen that when doing work across in the US, that all of the Caucasian individuals whom I interacted with had some history of skin cancer. Again, spending extended periods of time in the sun. Now, one big thing is to avoid sunburn. So if you are not accustomed being out in the sun, don't go take the whole full 45 minutes one time tomorrow. No, you start with 15 minutes for the entire week. And then another week you increase that by 5 minutes more. So you go to 20 minutes and for an entire week or two. And then so you start building up your tolerance. If you are on medication that makes you skin sensitive, then you have sun sensitive. You're on medication that makes you sun sensitive, you have another issue and challenge to look out for. So there you would be watching your duration of time and what reaction that you're getting back on your skin when you're out in the sun. But don't hurt yourself. Always be kind and to yourself. But we do need sunlight. We are born and to get that light onto us. Now people pay big money for this, huh? They go to saunas with infrared light and pay lots of money for it. And they go to even getting sleep. So sometimes you don't get that bright light in the morning, natural light. And that could affect your serotonin levels, not being high enough to convert to melatonin in the nighttime, in the evening. So getting adequate light throughout the day is really helpful. And people buy a light box and put it before themselves to get more light onto them through their eye to help their body to function well. So if you have sunlight around you, take advantage of it. So one thing, remember, don't burn your skin. Yeah. Then on the cracked window at night. Okay, yep, thank you. Sister James just sharing with us that if your window can be open at nighttime, so while you sleep, you are getting that fresh air on you in your room space and be able to inhale and exhale, get oxygen all through the time while you're sleeping. That helps to give you restful sleep like nothing else can. And it really puts you down solid, that you can sleep. There are times when I go to sleep straight until 5 o'clock, and I would be like, wow. So having your window open, cracked open a little bit, if not all the way. If you have the insect screen protectors, that's fantastic. So no mosquitoes to disturb you and wake you up. You would be able to sleep like a baby. All right, I think that's all for our questions. If you asked a question and we missed it, now is the time to flag that. But if not, thank you for your questions. Thank you for your attendance, your participation. And we do look forward
Yes,
to...
no, excuse, one more last question. What
Yeah.
about Greek yogurt? Is Greek yogurt good to use? You know, the plain one, and you could put you could put your artificial sweetening inside of it, and what is it, the fruit, and to give it for it not to be so black.
Greek yogurt. So, what does Greek yogurt consist of? So it says milk, whole, skim, or reduced fat, cream, and live active cultures. All right, so it's dairy. And if it is dairy, your Greek yogurt generally will be dairy milk. And therefore, that is not one that we would want to have. All right. Again, it's an animal source item, and by you consuming it, anyone consuming it, will have the same impact. We're talking about reducing high cholesterol levels, and that Greek yogurt will put that fat deposits into your bloodstream, build up over time, will adhere to the walls of your arteries.
Okay,
As
thanks.
simple as it might seem, you see, the thing is when we do it day after day after day, week after week, it compounds, and it will cause problems for us. Yep,
Okay, thank you.
you're welcome. All right, so thank you everyone, and we want to wish you a safe and blessed week. This session will be posted up on our YouTube channel, and you will be able to access it and share it with others. May God richly bless you. Good night.
Good night, Dr. Nash.
Thank you, Sister
Good night,
James.
everyone.
Good night. Good night, everyone.
Good night. Good night.
Hi, good night, everyone.
Good night. Good
And
night,
blessed
Dr.
night to
Nash. Good
everybody.
night, Yolanda.
Good
Good night,
night.
everyone.
Sister Olive.
Okay.
Who's that?
Good night,
Good night.
Dr. Nash.
Good night, everyone.
Good night. Good night.
Good night.
Hi, Yolanda.
Hi, Sister Olive. Call me
I'm so
tomorrow.
happy to see you online with me.
Thanks, Dr. Nash.
You're
Yes.
welcome. Take care.